Health Tech for Medicaid exists for us to bring payers, providers, policymakers, and entrepreneurs together to scale and innovate in the Medicaid space.
So I think the biggest impact is bringing together the right stakeholders, is bringing together folks on the policy, on the regulatory side, on the entrepreneurship side, on the payer-provider side, and getting the right stakeholders in the room and doing it around such key industry events like the JP Morgan Healthcare Conference and starting the conversation. I think we heard it well today from Andy Slavitt. There is no silver bullet. There's not one thing or company that's going to change everything, but it's really about getting the right people in the room together, starting the conversation, and working together or making a commitment to start thinking about these populations.
But I'm also here to tell you that this is going to end up very likely, in my view, being the best thing to happen for the work we all need to do on taking care of people and social determinants of health. It is going to hopefully begin to cure us of this fascination we have in healthcare with this quick fix idea that something new is going to save us from everything in the past. And guess what? Secret to share, years and a lifetime of abandonment, hopelessness, poverty, and racism can't be cured in 90 days. Shocker.
Solution to the challenges facing populations on Medicaid is not a single thing. It's a suite of things working in concert, and so being able to bring together people from different backgrounds and with different skills and expertise to work on the problem is really the only way to solve the challenges affecting these communities.
Like any problem, when you're trying to solve it as an entrepreneur, you need to understand the problem first, and to do that you have to really, not from an outside, but actually as a participant, begin to understand what intergenerational poverty can do to a community, and this is not a problem that's going to be solved by one company or by one particular solution, but this is going to require a community and a collective effort for many, many years.
The biggest thing Health Tech for Medicaid has done is get people together so they understand the common cause, and over time so that they have a voice in talking to the people in Washington and in each state where Medicaid operates. The impact of that long term is going to be better policies and ultimately healthier people on the receiving end.
I'm a former patient and beneficiary of Medicaid. And the bottom line is I understand from a very personal perspective the reason why health technology needs to be incorporated into Medicaid. I'm a patient living with type 1 diabetes. I have been on both sides of the fence. I have been employed and had gold level insurance. I've also been unemployed and denied access to my doctor because I didn't have my gold level insurance anymore. And if it wasn't for the services that I received through Medicaid and through federally qualified health centers, the reality is the thousands and thousands of people that we are now helping today, that wouldn't be happening, okay? Because I would not have been able to have founded my company.
I think Health Tech for Medicaid embodies a new voice in the industry for what progress should look like, all of the different parts that we're going to need to break down, fix, rebuild in order to get there, and most importantly, the community to make all that stuff happen.
I think everybody should be looking at and finding ways to get involved with Health Tech for Medicaid. I think even if you're in the healthcare ecosystem and you're not supporting Medicaid populations, you need to understand the challenges, you need to understand the program, you need to understand how it impacts other parts of the ecosystem, and I think awareness is kind of the first step for everybody.
There's 75 million people on Medicaid in this country. A little bit over 14.5 million people just here in California alone. That's 1 in 3 Californians. It's like 1 in 4.5 Americans. When you think of solving problems inside your health system, when you think of solving problems inside your companies, go beyond thinking about the problems. Go outside, go in the community, and really make sure that we're solving problems that will actually impact the lives of everyone.